Hi, my name is Katie Harrison. Today we will be talking about sickle cell disease. MP is a 38-year-old male who presented to the emergency department with shortness of breath and pain to the chest and all four extremities. After ruling out heart attack, MP was admitted to an intermediate care unit for sickle cell crisis. Pathophysiology. According to the CDC, sickle cell disease is a genetic blood disorder. Both parents must carry the sickle cell trait in order to pass it along to their children. During sickle cell disease, the red blood cells sickle or create a C or crescent shape. Crescent shape makes the red blood cells clump together in smaller blood vessels. Sickle cells have a very short lifespan, which causes anemia. Other symptoms include severe pain and multi-organ failure. Here are MP's current labs. Increased white blood cells indicate infection or inflammation. Decreased red blood cells and a low H&H indicate anemia. Originally, MP had a hemoglobin of 4.6 and a hematocrit of 13.1. After receiving 2 units of packed red blood cells, his H&H increased to 7.0 and 20.3. He also has an increased LDH, which indicates lysis of the red blood cells, often associated with sickle cell disease, and a positive sickle cell test. In the article Quality of Life in Adults with Sickle Cell Disease, it states that all 50 states in the U.S. have mandated sickle cell testing for infants before they're able to leave the hospital. Diagnostic tests for sickle cell disease include bone scans, X-rays, CT, MRI, and TCD. Treatment. The article Pharmacokinetics for sickle cell disease talks about medication treatment, hydroxycarbamide, which is currently the only disease-modifying therapy for sickle. Other treatments include continuous opioids for pain, also bone marrow transplant, and blood products. Prognosis for patients with sickle cell disease varies greatly. The varying degrees typically depend on when the patient was diagnosed and the types of treatment. The article Quality of Life in Patients with Sickle Cell Disease talks about chronic pain, multi-organ failure, substance abuse, and psychosocial issues. Oftentimes, these issues are all related. The chronic pain can lead to isolation, decreased self-worth, which in turn can lead to substance abuse. Also, just chronic pain can lead to substance abuse. Pain management isn't adequate. Nursing care. The article Sickle Cell Anemia stresses the importance of pain management. Proper diet, including high protein, high calorie, vitamin-rich, mineral-rich. Also adequate fluids, about 3 liters per day. Skin integrity, lack of oxygenation, and the fact that sickle cell patients are often on bed rest, and involving physical therapy and occupational therapy. Physical therapy because, again, patients are on bed rest and we want to keep them ambulatory when they're discharged. And occupational therapy because there's often easier ways to complete tasks that cause less pain for our patients. Patient education. According to Johns Hopkins University, important patient education topics include infection prevention, such as proper hand hygiene, immunizations for flu, hepatitis, meningitis, and pneumonia, eliminating stressors such as extreme temperatures, hot and cold, high altitudes, and just stressors of everyday life, when to seek medical attention at the first sign of infection or illness, increased pain or a temperature of 101.5 or greater, and also utilizing support groups. In conclusion, I hope you learned more about sickle cell disease and how to best help and manage